Wonderful. Good afternoon, Dr. Renee Salas. Thank you so much for joining us. Dr. Renee Salas is a Yerby Fellow at the Center for Climate, Health, and the Global Environment at the Harvard Th. Chan School of Public Health, an affiliated faculty and previous Burke Fellow at the Harvard Global Health Institute. She is a practicing emergency medicine physician in the Department of Emergency Medicine at Mass General and Harvard Medical School. She has served as the lead author of the Lancet Countdown on Health and Climate Change US Brief since 2018, and founded and leads its working group of dozens of organizations, institutions, and centers working at the nexus of climate change and health. Dr. Salas, thank you so much for your time.
Thank you for having me.
So, your work drew our attention because it is focused on this intersection of climate change and health, and in particular on building the resilience of our healthcare systems to climate shocks. Can you speak to us a little bit more about this work, how you got into it, its relevance for the moment, and what you anticipate we need to do to build resilience across healthcare systems for the future?
Sounds good. And all that in 2 minutes, right? We can fix that quickly. Well, thank you for that generous introduction. And I will put in a plug that the 2022 Lancet Countdown Global Report and US Brief actually just came out yesterday. We had a launch event, so would reference everyone's attention there for the global report, in addition to the US Brief and appendix, and we have a suite of resources. And I actually moved to senior author this year, and we have two amazing co-lead authors. And so I think as far as how I'll start, I guess, at one of the points of your great kickoff question there, and that's how did I sort of get into this to begin with? And I think for me, I read actually one of the second Lancet Commission report back in 2013. And I just clearly saw that climate change was threatening the very mission of why I went into medicine in the first place. It was going to be making our jobs harder to achieve our fundamental mission, which is improving health, preventing harm, and accelerating equity. And I think the journey from there has been that the health connections have really been ones that are likely more recognized and more studied, but you can have the latest technology and have all of the tools of the trade. But if you don't have the healthcare system infrastructure that you need in order to provide care, then we cannot get our communities that high quality, low cost, easily accessible care that people need. And so the healthcare delivery piece has been one that has been, I think, slower to rise to people's attention, but it's one that is gaining traction. And so I'm really glad that you're focusing in on that aspect in particular. And I think that there's a survey that we did with the New England Journal of Medicine Catalyst group, where we surveyed 800 organizations across the globe, and about 500 of them were within the US. And 70% said that they already were seeing that climate change was threatening their ability or impairing their ability to deliver healthcare. And I think they have been underestimating across that entire questionnaire. And so I think that 70% to me was high. I think as people are seeing that these climate intensified weather events are challenging infrastructure, power, and supply chains. I mean, three key aspects that are essential for me as a clinician and for us as a healthcare system to be able to operate to provide high quality care.
That's really interesting. Do you have an example of how a healthcare system, maybe one of the respondents in that survey, what has actually happened? What are they saying has happened where it's already affecting their operations?
Yeah, it's a great question. And I think examples, as always, highlight the relevancy of how this impacts our day-to-day. And I think first I'll preface it with another initiative that I've had the honor of being a co-director and spearheading, and that's the Climate Crisis and Clinical Practice Initiative with the New England Journal of Medicine group. And I bring that up because the goal of that it was launched in February of 2020. Little did we know, right before the pandemic striking. So it was one of my last in-person events. But the idea of that is to make sure that and make that connection for clinicians and healthcare administrators to see that climate change actually threatens their jobs and is making their jobs harder. And so it's not abstract, it's actually core to what we do. And I'd like to think of that as adding a climate lens. And so I'm a photographer, so that's probably why I gravitated towards that analogy. But it's really just trying to look at what we already do within healthcare and understand how is climate change impacting that now, and how will it increasingly impact that in the future. So some examples. So I think first off, when we think about power outages, actually a hospital just down from where I live in Cambridge, Massachusetts, it was a 90-degree Fahrenheit day in Boston. Again, not enormously high by most people's standards, but data has also shown that when the heat index is around 86 degrees Fahrenheit, patients actually have peak hospital admissions. So it's actually happening oftentimes, and there's regional variation, but it's often happening before we get to these catastrophic heat waves that really make headlines. And so 90 degrees Fahrenheit, they lost power, not for anything that was climate related, but because it was 90 degrees Fahrenheit, the top floor of the hospital actually became too hot for patients. And so patients had to be, firefighters actually carried patients down to the lower levels where it was cooler, because when hospitals lose power, their backup generators often do not supply the backup power to the HVAC system. So they're not actually cooling those areas. And imaging modalities and machinery actually became so overheated that they could not come back online for a couple hours after power was already restored. Now, I bring that up because that's probably one that, none of those features, 90 degrees Fahrenheit or any of those, would probably have raised any red flags. So think about when there's a climate intensified event and it's 110 degrees and there's a hurricane that just happened, as we often see with these compounding disasters, and then you don't have power. And then that obviously creates a lot of hazards. An example around supply chains is following Hurricane Maria. More than 50% of intravenous saline, literally water in a bag. So when we think about all the high-tech things we do in medicine, this is pretty basic. But more than 50% were produced in Puerto Rico. And following Hurricane Maria, which we know climate change has intensified as climate scientists did follow-up research, that caused shortages across the US and other countries. And so me practicing at Massachusetts General Hospital, we had shortages that if you didn't meet certain criteria, then I was handing you a can of Gatorade for hydration instead of providing IV fluids. Now you can imagine what patients thought when I'm handing them a can of Gatorade, but I think it allowed an opportunity for discussion, but I think also really highlights that we can't look in a rearview mirror anymore to understand what lies ahead of us. And so we have to have an evidence-based approach to understand where our vulnerabilities are, because these things are going to be increasingly happening. And so we have to understand them so we can optimally prepare for them.
So I just want to push a little bit on the concrete examples, because the examples that I have tended to hear have been hospital-based examples. But of course, much of our healthcare system is in the ambulatory clinic setting. So what are some of the things that, say, the pediatric primary care provider in, suburban Boston might see showing up in their clinical context that is a result of climate change?
Yeah, it's a great question. And I think one that we have some forthcoming work that really are going to try to create that expert consensus around, because it's important for us to understand where these intersections are and what the climate lens really means. I mean, I think one other quick thing I'll add is that obviously I know this system best because it's my own system, but Massachusetts General Hospital has done risk assessments to understand where their vulnerabilities are from flooding and winds and storms, looking at different climate scenarios. And so back to that previous point about having the data, there are some systems that are starting to do it, but I think a key piece that we need going forward is to make sure that data is local, because that's how it's going to be applicable to healthcare systems and offices and the entire, again, system at large. but also to make sure that systems who may not have the resources with which to do that themselves, that they still have access to that information, because we know we are all interconnected. So if one health system fails, the others are going to have to bear the brunt geographically. But to get back to your question is, so when I think about what that means for a practicing clinician, I think, from the clinical practice standpoint, it's recognizing that there are patients in I'll use your example, a pediatrician's practice, that are going to be at increased risk due to certain climate related hazards. Now, whether that's heat or thinking about air quality. So, asthma is a good example, thinking about fossil fuel generated air pollution. They live near a highway. I've never thought about a zip code or a patient's address as a vital sign, right? Vital signs, we're measuring your heart rate and your blood pressure and things that are important for patient care. But increasingly, we are seeing very clearly that when we look at the downstream harms of fossil fuel, whether that's air pollution or as it drives climate change, that your address does matter. So it could have a flag within an EMR, electronic medical record system, that could say this patient's address puts them at high risk based off what we know about air pollutants in this area. And then that could lead to intervention or counseling. Pollen levels are higher. Ground level ozone is higher because of heat, and pollen because of different climate change factors. So thinking about how to screen and identify those patients, and then to intervene and to have conversations with that patient to understand what are their unique vulnerabilities with higher temperatures. Do they have a backup if they lose power and they actually have need to run a nebulizer machine off of power? And so what are they going to do if they lose power? Most people who are blessed financially are able to run air conditioning, but what happens when the power goes out? These are the types of conversations that I think we as healthcare providers have to begin to have with our patients, because these situations are happening more frequently and our patients' health is at risk. And how can we work with them to develop those types of plans? And then I think the last piece, and again, I'm trying to keep this broad with a few examples, is when we think about even an outpatient office. I mean, that also requires power to run the electronic medical record system. And so losing power there, if they just shut down and can't see patients, and of course, that's going to divert those who need care to other local facilities who may or may not have power. And the other thing is around medications. So certain medications that we prescribe may have increased risk or place our patients at increased risk for heat-related disease. And medications are affected by heat. So epinephrine and albuterol, I mean, two life-saving medications. But if you leave them in high temperatures, such as a car during a heat wave, that they actually can become degraded and not be as effective. So then you think about our patients that are getting these multiple threats and multiple hits of not only being exposed by more climate-related hazards and risks that are making their disease worse, but then also the medications we're prescribing may not be as effective, or the pharmacy could be closed and they can't actually get them refilled. So I think that paints just the challenges we have, but also highlights the opportunities to develop an evidence-based and systematic and comprehensive way to assess it.
Now, what about our mental health system, right? Because we know that climate anxiety is very real. There was a recent Blue Shield of California survey that said a very significant number of Californians who are Gen Z, those born between 1997 and 2012, have identified climate change as a source of anxiety in their lives already. Is our mental health system up for the task of what's to come? And if not, what do we need to be doing to ensure that it is resilient in the face of climate change?
I mean, the short answer is no. And it's not ready. And I think it can be overwhelming to think about the interconnected challenges. And the fact I see climate change as what I often call a threat multiplier, meaning it's making existing problems worse. And so we know that the pandemic has created and pulled at the threads of our mental health infrastructure with increased need. I've seen that in my emergency department with more patients presenting with acute psychiatric needs. We know that especially rural areas especially have decreased access to some of these services, but even people in urban environments are struggling to get those resources. So the 2022 Lancet Countdown US Brief actually does highlight mental health as one of our 4 key areas to highlight the latest data on. And we don't have a Lancet Countdown indicator yet because it's from a global level, because it's a hard thing with which to try to quantify. There's some different proxies that we use to start to get to that answer. But we know that those impacts are there, and I think the evidence is clear, and we want to try to start taking steps down that path to begin to shine a data light on these hidden corners. And it's enormously broad, whether it's thinking about eco anxiety or climate anxiety, just with climate change itself, or extreme weather events creating PTSD or increased depression as people suffer through that. Drought, also, especially for people who depend on the land for their culture or livelihood. There's been links shown there. So as with all things, it's sort of this multifactorial intersections, which to me lends an enormous opportunity to rise above multiple problems at once, because if we can create a mental health infrastructure that is ready to handle these needs and all of the other interconnected crises that are worsening mental health, then we can begin to, again, get to the root cause and treat multiple problems at once. So I think happy to sort of refer to other experts who can dive into exactly what mental health system needs with which to become more resilient. But I can say conclusively that from a climate change standpoint, mental health system is not prepared, and it's an area where I anticipate growing needs, and we have to understand it and start to prepare for it optimally.
So who is responsible within healthcare systems for bringing a climate lens to, strategy, systems, operations within healthcare systems? And frankly, what are the sort of principles that need to be applied in that work that could actually be instructive to other systems like our childcare system?
I mean, the short answer is I think all of us are. I think we all have a unique role to play within a system, and I'm always reminded of the situations where I get the most inspiration, and that's when a patient's crashing in the emergency department and the room fills. Everybody has a different role, whether it's a pharmacist or the nurse or the radiation or the radiology technician who's taking the x-ray, right? We all have our different roles, but together, through all of us working together, we can create what's needed to save that patient's life. And so I think from a healthcare system, we have to work from both grassroots, so bottom up, and top down to think about these issues given the urgency. So I think first and foremost, the principle is to think about it. I can provide the link to that survey that we sent out to healthcare administrators, but I think it's clear that while there was a 70% of people were actually identified that climate change was having an impact, far less had actually taken actions with which to start to address their climate vulnerabilities. And I think there's only about a quarter have actually assessed their climate related risks, right? Back to that idea of making sure we have that data. So I think first and foremost, leadership needs to prioritize and recognize that this is a critical area that they have to set standards for and commitment to understand for their respective facility, but also to recognize that they're not alone in thinking about this. And how can we collectively make sure we can develop the expert consensus and data needed to guide all of us quickly, just like with the COVID-19 pandemic. We quickly generated data and people were sharing best practices, and we can do that same type of information sharing again around climate change. But we have to see it first, make the diagnosis, and then begin to implement the treatment. And then I also think there's an enormous opportunity for providers and health professionals, and whatever their roles are, to elevate that discussion to leadership that it is an issue, and to begin to implement the climate lens to their respective practice. And together, as we try to address it from all fronts, just like with a crashing patient, where we're implementing critical treatment along multiple avenues in that moment to make sure we can save that patient's life. We need to do the same thing from a healthcare system standpoint.
Great. And what is the message you're bringing to COP? I know you're going in just about a week. What are
Yeah.
you going to do and to say while you're there in Sharm el Sheikh?
So I think that this is coming right off the cusp of our Lancet Countdown launch, as I mentioned at the beginning. And so with that, the global report's main message is that health is at the mercy of fossil fuels, and we are seeing these downstream health impacts. And when I'm treating a patient, if what I'm doing isn't working to improve their health, then we do something different. And so we want to really sound the alarm that health is being harmed, that healthcare systems are being threatened and disrupted, and that we could undermine the public health gains that we've had over the past 50 years if we do not take action quickly. So our goal is to really try to place what should be our motivation to act on climate change, which is our own health and well-being. I love polar bears and icebergs, but I think that has created an abstract or disconnected perspective of what climate change really means. And the fact is that climate change touches everything we care about and threatens everything we care about, including our own health. And so we want that to be a message that resonates. And then also, though, to really highlight that there are enormous health benefits and that can be achieved through action on climate change and an equitable transition away from fossil fuels in a fair and just way. And that we cannot achieve true health equity without addressing climate change, given that is worsening so many inequities, not only here in the US, driven by economic injustice and structural racism, but globally. And so we're carrying this report, the 2022 report there. And so I'll be doing some different engagements there, including a presentation at the World Health Organization's Pavilion.
Great. Well, thank you so much, Dr. Salas, for your time. This has been great. And we look forward to sharing this message and your work with those in our network and certainly the work of the Early Years Climate Action Task Force.